Welcome to Logic subscribers and Logic non-subscribers. If that's you and you're just interested in the subject that we're going to be talking about today, there's probably more in the Logic that would interest you as well. We have a subscription team that will be happy to fix your non-subscriber status for you. And if you are a subscriber and you think that people on your team ought to be reading the Logic, there'll be information in the chat about our very attractive group rates for subscriptions for whole teams. The more the better. We love to have you. We're going to be talking today about our national health. My name is David Reevely. I'm a reporter in Ottawa for The Logic. I cover health, among other things, and I've been something of a health reporter in the past. I covered the Ontario government for a while, and that's approaching 50% paying attention to health and hospitals, because that's where so much of the money goes. We're going to be talking about this today because if you're like me, I think you have a sense that people are under a lot of strain. People don't necessarily feel confident in the health system. They don't necessarily feel confident in their own ability to get the care that they need. People feel under strain. People feel anxious, sometimes depressed, and people are worried about their finances. And all of these things are intertwined. If you're not healthy, then it's hard to do good work. If you're having difficulty at work, then it's hard to take care of your health. All of these things are intertwined, and they have implications for the national economy and the future of this country. So to kick us off, I'm going to bring in our sponsor for this, Dave Jones, who's the president of Sun Life Health and who has a profound interest in the things we're going to be talking about. Dave?
Thank you, David. I am very excited to be here this afternoon and honestly thrilled that Sun Life is the presenting sponsor of today's event. Living well, a holistic approach to national health, is such a timely conversation. We're here to explore an important and a big question, which is how does health and well-being, drive Canada's economic prosperity? It's obviously complex, not easy to solve, but I do hope we all leave today's session with new ideas, new perspectives, and fresh inspiration for the future. You know, when Canadians are physically, mentally, and financially healthy, they're better equipped to thrive at work. They can support their families and they can contribute to all of our communities. As employers, we know that when employees are healthy and when they're performing at their best, businesses thrive. And thriving businesses, create benefits for our country. I realize that I try to make it sound easy and it's anything but Canadians aren't as healthy as they could be and as they should be. A few years ago, 2021, the Commonwealth Fund, and we've all heard these surveys from different organizations, ranked the top 11 high-income countries on key health system metrics. These were specific. They included healthcare equity, access to care, affordability, healthcare outcomes, and administrative efficiency. Canada was on that list, and that's the good news. But we were ranked second to last, 10 out of 11 on the key metrics. Canadians are definitely struggling when it comes to their health and well-being. And again, something else we're all familiar with, but I'll share a couple numbers. Care is out of reach for far too many of us, or somewhere around 6 million Canadians don't have a family doctor. And for those that do have a family doctor, the wait can be days or even weeks, with 4 in 10 people saying that it took more than 6 days to get an appointment with their family doctor the last time they urgently needed it. Chronic disease is on the rise. Today, almost half, about 45% of Canadians, live with at least one major chronic disease. Diabetes Canada tells us that by the early 2030s, 2033, they predict over 5 million Canadians will be living with diabetes. And that's a huge increase over just 2023, 10 years. Mental health also continues to be front and center. In our business, where we support employee benefits across the country, from 2019 to 2022, obviously consequent with the pandemic, the number of Sun Life group claim plan members making mental health claims grew by almost 70%. That's 70. We know that when one area of your health takes a hit, physical, mental, or financial, that the other two areas are also at risk. Canadians are financially strapped and stressed. And I'm not telling you anything you don't already know, but I bet many here, either themselves or through their relationships, friendships, and family, have experienced it firsthand. Taking retirees as an example, 34% of retirees tell us that their current cost of living is higher than what they've planned for, and they're facing a scenario where their savings may not last their lifespan. So where do we go from here? Today's conversation. No single sector, public or private, can tackle these issues alone. It's not about public or private. It's going to take collaboration. It's going to take bold innovation and bold ideas to ensure that every Canadian either gains or continues to have access to the support they need to live their healthiest life. I spend my entire day thinking about the health of Canadians and how does Sun Life help make our clients and communities healthier right across the country. From workplace wellness and savings programs, right through our health programs, our goal is to empower Canadians and to help them build their more sustainable future for themselves and their communities. So as we chat through the next hour, and I'm going to hand it back to David momentarily, I encourage you to think about that, the physical, the mental, and the financial health of all of us, and broadly all Canadians. For the leaders on this call, I hope you'll think about your organization, your employees, and the communities you influence, and what we can all do together and what your organization can do. And I hope the conversation leaves everybody feeling just a little bit inspired and very much empowered to work together to solve this problem for Canada. Thank you very much, and over to you, David.
Thanks very much, Dave. Great scene setting there. Before I introduce our star panel, people who are very accomplished in some disparate fields who run into a lot of the same issues, as it turns out, I want to ask you, the audience, to be sure to ask your questions and share your thoughts. We want to talk about what you want to talk about. Put your questions in the chat. I'll thread them through as much of the conversation as I'm able to. But now, the panel, the star attractions. We got, as I say, three people accomplished in different fields who run into a lot of the same stuff. First up, Shannon Lee Simmons. She's a certified financial planner and author with particular expertise in how millennials are thinking about their money as they're thinking about something beyond just going to work and what's going to come after that. Dr. Quam McKenzie, who is CEO of the Wellesley Institute, which is based in Toronto and is focused on the social determinants of health. But he is also a practicing psychiatrist and a professor of psychiatry at the University of Toronto, among many other things. And third is Naomi Goldapple, who is the Senior Vice President of Data and Intelligence at AlayaCare, which is a company that provides a technology platform for home care agencies. So a field that is seeing enormous growth. Panelists, welcome.
Thank you for having us.
Thank you.
So glad you're all here. So we got a view from 30,000 feet from Dave Jones, but I want to ask each of you in turn, starting with Shannon, how are the people you serve, how are they doing? And how is that different from, let's say, 5 years ago? Some big stuff was about to happen, but it hadn't happened yet compared to right now. How are things different?
Yeah, so I've been doing this for almost 20 years, and I'd say unprecedented change in the last 5 to 7 years with the cost of living. So similar to what was already said, a lot of my clients who are retiring, it's higher cost for them. A lot of the middle-aged people that I'm working with, the costs are higher. And I think that that is impacting everything, whether it's the cost of housing and all of that. So people are feeling stretched and broke, even if they're not on paper. So they have good paying jobs. They never expected to feel as broke as they do. So I think that the general level of stress is so much greater than it was even 5 to 7 years ago with, stress for the future and anxiety and loss of sleep. So I would say I'm definitely seeing the level of anxiety and stress on the rise.
Let me dig into that just a little bit. Is that a feeling people have, or is it driven by reality? You've seen the numbers before. You've seen them now. Is it a real thing?
It's a real thing. And it's also, I think, the pressure to spend and what we think is our expectations around what normal is and what, the things that we need in our life versus the things that we sort of want in our life has gone up exponentially. I blame social media. And so I think that the real part is that the cost of housing alone, if you think about the sizes of mortgages that people have that maybe bought a house in the last 5 to 7 years versus the people who bought a house 10 to 15 years ago, their mortgages are quite a lot bigger on average. Rents have gone up for the renters out there. And so the actual amount of after-tax income that's going towards housing, there's no denying that that's gone up on average. That's real. And the cost of living and inflation and the cost of food And the feeling part is what I thought I'd have versus what I can afford. They're not lining up, and so it's both.
So, Quam, how does this play out in your world? How are things different now versus 5 years ago? The kind of help people are seeking, the kind of help they need.
Well, things are, I think, very similar to what others are thinking, that people are feeling more stressed. And because of that, we're seeing more people with mental health problems. So we're seeing more people with anxiety and depression and worries than we had before. Now, some of that is most definitely because of financial issues, but other things such as food insecurity, climate change. We see a lot of climate change worry in youth. All of these things are feeding in. And we're seeing people feeling more lonely, more disconnected than ever. So at the moment, it's usually bleak. If you're asking a psychiatrist, what do you see? Well, we see people who are distressed, but we're seeing more people who are distressed, and it feels like this distress is more profound.
Naomi, your turn. You deal with a particular sliver of healthcare in home care. How is demand different now from what it would have been in 2019?
Yeah, great question. So a couple of things that we've definitely noticed is, especially since the pandemic, that people want to stay at home more than they did before. The scare during the pandemic of what happened in long-term care facilities definitely changed the focus of where people wanted to put their loved ones. But we have noticed that people are at home sicker than they were before. So higher comorbidities, more chronic conditions. So that puts a lot of stress on family members as well. So not only do we have an aging population, so I was saying I think our youngest baby boomers are all turning 80 in 2026. So there's they call it the silver tsunami. So there's a lot of elderly people wanting to stay home. People are sicker, and that puts a lot of burden on the families to be able to help the elderly population complete their activities of daily living, while a lot of times still raising their families at the same time. So they do call that the sandwich generation. So there is a lot of pressure coming from many sides. So people getting older, staying at home, needing help from the family while people are trying to live their own lives. So that is putting a lot of pressure on, as well as an overall labor crunch when it comes to the availability of nurses and caregivers to be able to even hire and to help with your parents or with your loved ones at home. So many different factors at play.
More people aging, more people wanting to stay home, so a greater proportion wanting to stay home, and they tend to be sicker, and there aren't enough people to take care of them. That's a quadruple win.
Yeah. Yes. It's the truth.
So Quam, let's tie this. The Wellesley Institute deals with social determinants of health, other things that lead into health that are not germs or injuries. How does this play out on a larger scale? What is the impact, basically, on the larger society of people who are feeling all these different kinds of strains?
I think that the impact that we have, obviously, on the wider society, on the healthcare side, with our boomer population getting older, but not being as well as we expected them to be. I mean, that puts tremendous strain on health services, but it also puts a tremendous strain on families and communities who are looking after, who will be the surrogate carers of boomer populations. When it comes to mental health, the increased rates of mental health problems and more people with mental health problems makes our economies less efficient, and obviously individuals less wealthy. They say some people used to say there's no health without mental health. The truth is there's less wealth without mental health as well. We know that back pain used to be the most common reason why people are absent from work. But now we see that mental health is giving back pain a good run for its money. But on top of that, one of the issues you have with mental health problems is presenteeism. So people who are at work but are not working efficiently and effectively because of their mental health issues. So we all, whether it's as carers or whether it's as employers, we're all feeling the brunt of people feeling stressed and sicker than they were, and the fact that we've moved. And I think this is one of the things that Dave had said, that Canada came 10th out of 11 high-income countries when looking at the health service. What he didn't say was, if you look at 2 polls before, we're second or third. So it's not just it's that our health service has changed in the Commonwealth rankings over a period of time as we have underfunded it relative to its need.
So it's not that everyone is declining, it's Canada in the sphere is declining relative even to the comparator countries. Is that right?
It's that we haven't always invested at a provincial level to meet the needs of our populations. And one of the things we used to be able to say is, well, it's not so bad, we're better than the United States. Well, now we have to wake up to the fact that we're not better than the United States. And one of the crucial areas where we're not better than the United States in healthcare is in equity of our healthcare. So we used to be able to say we have a socialized healthcare that's free at the point of access, and therefore that's okay, everybody can have access. Well, it doesn't work like that. You actually have to, reach northern and remote. You have to reach marginalized populations and racialized populations. You have to do the hard work to reach them. So I think there are lots of things that we could do and we've done before, but we really need to go back and find our mojo around our health service, because we've got great people.
I'm going to bring in a question from the audience, and please, ask more. As I say, this is what it's about. I'm going to put to Kwam and then to Shannon. Are you seeing any impact from people increasingly working at home as a result of the pandemic, or ways of working that have stuck, not having the social connections maybe that they had at workplaces, or struggling to balance being at work sometimes and being at home other times? How's that playing?
Well, I think that there's quite a lot of evidence that we had a growing epidemic of loneliness before the pandemic. And it's interesting that there are some countries like the UK that have a ministry of loneliness. I always joke is that the smallest ministry that you can probably have, but joking. But they actually have a minister whose job is to look at loneliness. Now, what's happened in the pandemic, obviously, is the pandemic's has been good at accelerating existing problems. We had mental health problems, an epidemic of mental health problems before the pandemic. It's got worse during the pandemic. We had loneliness growing before the pandemic. It's grown through the pandemic. And yes, we don't do social connection as well as we could. And it's something that we should really be thinking about, because yes, it breeds mental health problems. But one of the other things it breeds is a reluctance to pay tax. And so the less people have in social connection, the less community orientated they are, the less happy they are to put money into social programs. And therefore we get into a little bit of a vicious cycle where there's less social capital, and then there's more loneliness. And so we go in a circle. So someone has to break the cycle.
Shannon, original question more or less to you. How has people's relationship to their jobs changed when they
Yeah.
work if they're not
The
ultimately?
pandemic, financially speaking, on the micro level, right? Like on the home front, kitchen table finances, was actually helpful to a degree because a lot of people were able to move outside of an urban center where they were forced to pay higher rent and higher home prices. And now they could work remotely 100% of the time in a smaller town, get a bigger place for the same amount of money, or potentially even buy a home, which was completely off the table if they had to stay where they had to commute. And so also I find with commuting costs, it was a relief to many people to not have to pay those commuting costs. So, and one other thing too, a lot of feedback around being able to save on lunches out and making your own food and doing that, those convenience spends that when you're busy and you're out all day, you can't necessarily afford. So there were some microeconomic wins of stay at home, which is not equitable because not everybody can stay at home. So there's some part of the population who gets that and some that don't. And I find that to be a real tension that I see between how people are feeling about stuff. But I would also articulate that some people moved out of where their family and friends are in the name of buying a home or saving money there, and then adding to that loneliness piece as well because they've removed themselves from their community because housing was just too expensive there. So I definitely feel like the pandemic took those have-not situations and exacerbated them financially. So it depends on which side you're on as to whether or not it was helpful or not.
Okay, we've kind of set a fairly grim scene here. Naomi, I'm going to ask you to give us a little bit of hope when it comes to healthcare and caregiving. What are some interventions that you've seen work? What's effective?
Yeah, I was going to try to put a little silver lining in all this as well. So I think there's a couple of things to say. Is there are some programs, so not yet in Canada, but hoping this will come soon, where certain geographies have said, you know what, we want to try to tackle this. So for example, in New York State, they have a program called CDPAP, which is a consumer directed personal assistance program, where people at home have more of a say of who is it that is going to take care of me. So as opposed to having like a nurse or personal assistant taking care of them, they can designate a member of their family, because this member of their family is doing it anyways, right? They're doing it anyways and they're not being compensated. To actually have a program that is compensating them and recognizing, we know that you're probably working full time and doing this on the side, they can actually be compensated for this. So that is a more progressive way of thinking about it. There's other geographies that have, in Australia, where we deal also, where they have something called home care packages, where the individual is given a bunch of money and say, you decide how you want to use this for your care. So there's other models that exist than we have here in Canada. And as we were saying before, as one of the other panelists was mentioning, in Canada, it's not necessarily equitable because in theory, everybody has access to provincially funded home care. But in reality, unless you are a very high priority, you will be on a waiting list for a very long time and therefore forced to, dig into your own pocket to be able to pay out of pocket for that type of care. But the really exciting part is really technology. So how can we be using technology, leveraging, especially in the past, 18 months with large language models, how can we be leveraging all of this to make the caregivers more efficient, so that they can spend less time with administration, more time with the actual end patients, and the whole process
Tell
can
us
be
about
more
that.
efficient. Yeah, so
Tell us about that. How does Alaya Care do it?
Yeah, so there's some things that we've been doing that have been really exciting. So for example, every visit that happens, every interaction between a clinician and a patient that happens, there's a lot of data that's being collected, right? And that data can be collected in, forms, in a structured way, or it can be a lot of narrative. And the narratives are very important, what the nurse sees, what the personal caregiver sees, and they can be, notes that they're taking through the visit. Now, historically, it's very hard for a supervisor to be able to read all of those notes that are happening every day and actually if they find something to mitigate, to prevent any risks, any hospitalizations, any adverse events of happening. But now with large language models, we can have the models automatically read these notes, pull out whatever's important and alert a supervisor to something, and they can mitigate right away and, genuinely affect the outcomes and, prevent a hospitalization, an ER visit, send in another visit, alert a family member, have other types of interventions. Could be a social worker, say this person is just lonely, they need some intervention there, which could prevent hospitalizations, as well as using algorithms to be able to have efficient schedules and routes so that we use these precious resources most efficiently, so that they spend less time driving from visit to visit and more time with the patients. So tons of opportunity there. That's really making this very exciting.
Just to add to that, so that I don't sound like the angel of doom, there are, one of the things that is true is, I've been in medicine now for 30 years, and it looks completely different now than it looked 30 years ago. And it will look completely different again, but things are accelerating. So in 10 years, it will be different. Anybody who has one of these watches that like an Apple Watch or whatever, you can expect that to be reading your glucose level as well as your heartbeat, as well as other things. You'd expect that to be able to identify problems very early on and send alerts to your, whether it's your family doctor or to a hospital or to you, so that you're empowered to do something about it. There's huge amounts of data that you are giving at the moment free to Apple and other people that can be used to make your lives better and safer. There are a whole bunch of chronic illnesses that don't really need to be treated in hospital. But if you've got in-home monitoring, which is coming and which some of the hospitals are doing, you're going to be able to be treated as much at home with safety protocols in place as you could in a hospital. And some of the work that's happening with some of these algorithms and protocols at the moment is they're saying, but they seem to be one size fits all. How can we make sure that they work equitably for different groups across Canada? And there's loads of work going on at the moment trying to make sure that it's not one size fits all. It's actually tailored medicine that's going to work for you, taking into account your specific needs. So it sounds like doom and gloom because the pressures on us have increased. But if we were to fund health services properly, we would be able to reap the benefits of innovation. And if we went further and started thinking about wellness, not just illness, we would actually be able to stay healthy for longer.
Let me follow up by asking you briefly to talk about some specifics in the practice of psychiatry and promotion of mental health. What are some of the recent innovations in that part of your field that make you say, ooh, that's excellent?
Well, I think one of the things, apart from the fact that obviously I think the destigmatization of mental illness has been really big, and that people are actually coming to try and get care, I actually think the fact that we have evidence-based treatments that you can take over the net, right? You have what's called ICBT, so internet cognitive behavioral therapy that you can do yourself. It works really well if you've got mild or even moderate anxiety and depression. That's a game changer, for self-help. But for me, I'm really interested in getting upstream in preventing people getting ill, not waiting for people to get ill and then saying, get some ICBT. And I'm really interested in psychological resilience. And I always say that everybody talks about the 5 a day, 5 bits of fruit and vegetables that you need in order to keep your heart healthy. But people don't talk about the 5 things that you need to do to keep yourself psychologically healthy. And those
What's
are
that list?
Connect, exercise, learn new things, mindfulness, and give back. So the first one's connect, keep connected with friends and family, not just by text, actually voice or face-to-face is better, keeps you psychologically well. Exercise, healthy body, healthy mind. You can spend 23 hours a day doing nothing, as long as you spend half an hour a day doing some exercise, right?
Anything's better than nothing, right?
Anything's better than nothing. Half an hour's enough. Learn new things. Exercising your brain by learning new things really makes a difference for your health. And mindfulness, learning how to enjoy everyday things, changes your mental resilience. And last, give back, volunteer, help in the community, work in the community. The energy and support you create through giving back is huge, and it really makes a difference to your psychological resilience. So if you can connect, exercise, learn new things, learn a bit of mindfulness, which you can do, just look on the web and you can find out how to do it. And if you can think about how to give back, you will build psychological resilience, decrease your chance of having a mental health problem.
I thought mindfulness was a bunch of nonsense until I tried it. It really does make a difference.
It does make a difference.
New age, I don't know, crystals, something like that.
It sounded like something that you did in
not.
sandals, yeah?
Yeah, exactly.
No, it's good stuff.
Shannon, let me ask you for one thing that you wish employers would pay attention to when it comes to employees dealing with these sorts of strains.
I was just going to jump in and talk about that specifically. So one of the things I see on the financial home front is that there's lots of will to do preventative healthcare, preventative mental health care, like in therapy and doing wellness, and a lot of these services that are sort of part of that holistic part of someone's health that is not an emergency response to there's a problem and now I have to go, cost money, right? Whether it's massage, acupuncture, making sure that you go to therapy, or like whatever it is that keeps you well and healthy, and even personal training, gym memberships, and this kind of thing. They are expensive. And a lot of people don't have access to benefits that cover enough, or that would cover the vast array of the different things that people need. And so they don't get spent on as the cost of living goes up. For the more I need food and I need groceries, food, insurance, my car, and my rent, then there's not as much to spend on those kinds of extras, and they shouldn't be extras. And I think that we know this, but they fall into that sort of like extras choice or like wellness, which doesn't get as much. It's not seen as healthcare; it's seen as wellness. And I think people approach those with different mindsets when it comes to their money and how they spend it. So if there was, if it became cheaper because there was more technology to help out with that on the whole, or people could do more themselves, that would be a win, or that is a win. And that's a hopeful one as it goes forward. But also if there were benefit packages that were very robust, I think that could be very helpful for the average Canadian family.
So just to kind of jump in there,
Sure.
All the things that I was talking about, the 5 things for psychological health, they're like cheap or free.
Yes.
And the question I would have is, is there a universe in which those could be added and promoted by employers? Because, I think in the intro and from David and Dave, both of them were talking about, if you can keep your psychological health, you can improve productivity in the workplace and therefore economic outputs. And you sort of think, well, what about these evidence-based sort of upstream things which are cheap? Is that something we should be thinking about? Is that something that Sun Life and others should be thinking about?
You know what? Dave Jones is still in the background here. John, director, can we bring him in and talk about what options there are when it comes to workplace benefits? Hey, look at that.
Hey there. I'm happy to jump in. I love your comments and questions and the suggestions. I would say definitely, the benefits industry doesn't have all the answers, but I do think many of those things exist. So, I think the key is encouraging, as you put it, like having employees use those things that are free or near free, and then also encouraging employers to invest in the program. So I'll just give you one or two quick examples and then turn it back.
Yeah.
So for example, through Sun Life bought a company called Dialogue. They're a phenomenal company, and they have a program for employers. So a Sun Life employee, as an example, has, I think it's 12,000, don't quote me exactly, but 12,000 per year in mental health benefits. But you can actually buy a program from Dialogue where every employee and their family can have access to unlimited ICBT, CBT, and access to therapy face-to-face over virtual connection. So those types of programs exist. And then the next evolution of EAP programs, which most people don't know what an EAP program is, but the one we now offer is a digital first EAP program. And it does include the actual app that people are using has those wellness tools built in to encourage proactive actions on the part of employees. I think, in fairness, in those types of programs, it comes down to the individual's willingness to actually practice mindfulness and practice social connection and exercise. I could fill the entire session with the Sun Life benefit options, but I appreciate I won't. Those are just a couple of examples, and I think more forward-thinking employers are starting to do that. And I would agree that an across-the-board movement's required.
Can I just add one thing, Dave? Just to add to that.
Briefly, I want to get to Naomi on this.
Yes, yeah, I know. Is that there's one thing having them in EAP, but a lot of people only access EAP when there's a problem. And I was suggesting that, is it possible for these things to be something that you expect, say, for instance, when you join a company, that the EAP say, you're joining the company now, here are some wellness tools that I want you to use. Don't wait. These are not things that I want you to do. I don't want you to wait till you're sick. This is what we want you to do as part of your getting it, how can I put it, orientation to the company.
In a 10-second answer, because David's going to go to Naomi, 100% agree. And the benefits industry, and you're starting to see this happen and more, but it needs to be, I'm joining a company, I get access to a variety of health offerings, and that should be the starting point rather than it showing up after the fact. You're starting to see that happen, and I think that's a great challenge to the entire industry. Well put.
So, Naomi, to a significant degree, home care is about preventive care, right? It's keeping things from getting worse, keeping people in their homes so they don't have to move into long-term care or go to hospitals. Are there things that governments ought to be doing to make home care agencies, and I know you are not a home care agency, but to make home care agencies work easier and more efficient?
Yeah, I mean, we like to say it's not necessarily about making people more well. It's more about, aging with dignity. So being able to really age where you want, surrounded by who you want, is really the goal. And so that people are able to do their activities that they want to do while they're at home. So it's always been, I always say that the home care has been the kind of the distant cousin or the poor cousin of the healthcare industry, because the lion's share of the funding obviously goes to hospitals and physicians, and then drug programs, and there's not as much funding left for the rest of what's needed in home care, including some of the things that have been mentioned. So there's a struggle, and it's also hard to change the mindset of, this is the way the allocations have happened, and therefore now we want to vastly change it. It's very slow, right? Those type of things. And also there isn't the clear data, because that data isn't necessarily being collected so that the governments can really say, aha, this is the ROI I'm getting for every dollar spent in home care. This is what I'm actually getting. So it's starting to collect that data, but without the data, you can't really make those decisions. So there's a lot that has to happen. So the government is definitely there's more of a spotlight that is being put now, and that has happened during the pandemic, which is great. And what I've definitely seen a shift is that the home care agencies that we were working with 5 years ago, some really even still paper-based, which is, frightening for this day and age. But now we're really
Paper-based.
seeing them become, definitely paper-based. So when you ask, how are you doing your scheduling? It's, a bunch of piles of paper, some colored highlighters, and, putting things around, and these are the schedules, right? So we can't be giving efficient health with those type of processes. But we've definitely seen a big shift where the companies are getting a lot more professional. The companies that we're dealing with are starting to have even data departments where they're starting to get a lot more data driven and becoming a lot more digital so that they can run a lot more efficiently. And it's also, they want to be able to attract the nurses and the caregivers. And if they have, a smooth running organization and they have exciting technical offerings, that's more exciting, right? To the actual caregivers, especially the newer generation. They want to be working with the latest tools. So this is definitely a shift that's happening. There still needs to be some, I would say, some marketing so that the industry itself gets a little more, a little sexier in terms of, if you want to be going into home care, what does it entail, and how it can be a very rewarding career. I always say that we should start like a reality show and focus on caregivers so that everybody would see what an exciting career it can be. So that's the way some things are playing out right now.
So, Quam, I want to put a question to you about mental health and who's afflicted by it. It originates from one of our audience members, Ali. Have there been changes in who is either suffering from mental health problems or at least is coming forward and asking for help with mental health problems versus a few years ago?
Yeah, there has been a change. One of the things that we've seen is a significant increase in the rates of mental health problems in children, adolescents, and youth. So we've seen that grew hugely through the pandemic for various reasons. Some people, we had the highest rates of school closures and things, but there are loads of other reasons. And climate issues have also fed into that. But we've also had a significant increase in women between the ages of 18 and 55 for various reasons as well. Surprisingly, we thought that we would be seeing significant increases in mental health problems in older people, but that, as far as I can see, has stayed pretty much the same. But it's not all mental health problems. So we've got mental health problems, but we've also got a significant increase in the use of substances. And as you know, we've got, I've used the term 3 times, but it's true. We've got an epidemic of deaths due to substances, which are mainly due to toxic supply of fentanyl that we're trying to get under control.
And each one of those deaths, of course, echoes and reverberates across many other people's lives, in addition to the one that's lost.
Yes, and because a whole bunch of them are preventable, right? So
yeah, we're nearing the end of our time, but I'm going to ask each of you in turn, starting with Naomi. There are many problems, many things that might be done, but if you could grab the world by the lapels and make it do just one thing that you think would make a big difference, whether it's individuals doing something or governments or employers as a group, what would that be?
Well, I think awareness, and I think, well, I'm going to focus on adoption of technology. I think it's almost a crime to not be embracing the technology that's available to us today. And this has to start with the governments really prioritizing introducing this type of technology so that we can really reap the benefits. There's been, I think you started off saying that, people at home, people at work, if they're not healthy at work, then they're not going to be very productive. And this is 100% true. So in our world, if you have people who are trying to work while trying to, help, caregivers and try and be a caregiver at the same time, very, very difficult. If they have funded, devices where there are devices that are monitoring your loved ones while you're at work, that really does give a peace of mind. that even though you can't be there 24 hours, that there is technology that can take over. So I think everybody kind of breaking down those barriers and embracing that type of technology will help tremendously, so that we can kind of have the eyes and ears there when we can't physically be there.
Kwam, your turn. What if there were one thing you could make the world do, what would it be?
One thing the world could do, this is going to come off from left field, I'm afraid, is
Great.
that I think underpinning everything we need is a move away from me to we, and a narrative from them and us to us. And I think unless we can start changing the narrative and remember that we are better when we work together, and we're better than when we support each other, and that we have a duty to each other, it's going to be very difficult for people to really thrive. Because how do we break down the silos? How do we get more funding into services? Yeah. How do we reinvigorate the care economy? How do we get people to want to be family doctors? Because at the moment they don't. Yeah. All of those things rely on a pivot in the way culture's going. And so if there's one thing I would want, is I would really love various people in government to stop being divisive and start thinking about how we can make things better together.
Shannon, when it comes to people's comfort with their finances and helping people feel secure, what's one thing that you wish we could do?
Oh, this is also going to sound like it comes out of left field, but I would say, I mean, the black and white answer is get off social media, but there are many things that I mean in that when it comes to your finances. I think that our expectations around what is normal or what the pressure to spend is so heightened by online presence. So I'm not saying get off of it, but be very aware of it. And also with that technology, with finances, sometimes it's helpful, but also sometimes it's leading to very much overspending, right? You have a weak moment, you're feeling insecure, you're feeling like you're not enough. You see all the people doing these things, and all you have to do is tap a button at 2 a.m. and something arrives at your door the next day. And so this hyper consumerism is making it feel like we're broke all the time. And when the cost of living is actually rising, we become broke over time. And I think if we all just sort of got out of that pressure cooker of how intense it feels all the time, there would be more sort of reflection for appreciation around what we do have, and then also what other people don't have, and how that could sort of get equalized over time. So I would say deep appreciation, and maybe really paying attention to how social media is impacting your finances.
Good thought. I could talk to you all afternoon, but I am told I'm not allowed to do that. So I want to thank each of you for your participation. Naomi Goldapple, Dr. Kwam McKenzie, Shannon Lee Simmons, and Dave Jones in and out from Sun Life Health. It's a gray, grim day here in Ottawa, but there's been some really warm thoughts. I feel really, really good about this conversation. Thank you to all three of you.
Thank you.
Thank you.
And Invisible Dave as well. And I want to thank the audience. We do it for you. So we hope you got something out of this. Thank you for joining us. If you did get something out of it, please tell your friends. If you're not a subscriber, as I say, we're happy to fix that. We are excited to bring you more of these events. We have one coming up that is subscribers only. It's this Thursday at noon Eastern time, 9 o'clock Pacific. You will not want to miss our quarterly call between April Fong, who's the Logic's executive editor, and Kevin Carmichael, our economics columnist and editor-at-large, talking about the state of things. And man, things have changed a bit in the economy since the last quarter. Get a subscription before the event, and you can be part of that too. The subscription also gives you an outlook on the stories, the opportunities, and headwinds that we are all facing as we head into 2025. So thank you again to the speakers, the panelists, to the audience. We'll see you again soon.